You start feeling thirsty all the time, even after drinking water. You wake up at night to urinate more often than you used to. Your energy fades by mid-afternoon, and simple tasks feel heavier than they should. You notice blurry vision when reading your phone? Small cuts on your skin take longer to heal. Your feet tingle or feel numb, especially at night. At first, these changes are easy to dismiss. You blame stress, getting older, or a busy schedule. Over months or years, the symptoms slowly worsen. Sometimes they appear suddenly after weight gain, illness, or a period of high stress. Many people feel fine until a routine blood test shows a problem. That quiet progression is why type 2 diabetes often goes unnoticed for years. When you eat, your food is broken down into sugar, called glucose. Glucose is fuel. It needs to move from your bloodstream into your cells to be used for energy. Insulin is the hormone that opens the door to let glucose into those cells. In type 2 diabetes, two problems develop. First, your cells stop responding well to insulin. This is called insulin resistance. The door is still there, but it does not open easily. Second, your pancreas, the organ that makes insulin, struggles to keep up. It produces more and more insulin to overcome the resistance, but over time it cannot keep pace. As a result, glucose builds up in your blood instead of entering your cells. Your cells are starved for energy while your blood sugar rises. High blood sugar pulls fluid from your tissues, causing thirst and frequent urination. It damages small blood vessels, which affects your eyes, kidneys, and nerves. It also weakens your immune response, slowing healing and increasing infections. This process happens gradually, often without pain, but the damage accumulates silently. Type 2 diabetes develops from a mix of genetics and environment. Family history matters. If close relatives have diabetes, your risk is higher. Age increases risk, especially after 35, but younger adults and even teenagers are now affected. Lifestyle plays a major role. Diets high in refined carbohydrates, sugary drinks, and ultra-processed foods overload the body with glucose. Long hours of sitting reduce how well muscles use sugar. Lack of sleep disrupts hormones that control hunger and insulin. Chronic stress raises stress hormones that push blood sugar higher. Hidden contributors are common. Fat stored deep in the abdomen interferes with insulin's action more than fat elsewhere. Certain medications, sleep apnea, and repeated crash dieting can worsen insulin resistance. Many people do not realize that years of mild weight gain and poor sleep can slowly push the body toward diabetes. Treatment focuses on lowering blood sugar, protecting organs, and reducing future risk. Doctors often begin with lifestyle changes because they directly improve insulin sensitivity. Regular physical activity helps muscles absorb glucose without needing as much insulin. Even daily walking makes a measurable difference. Nutrition changes are tailored to the individual. Emphasis is placed on whole foods, fiber-rich vegetables, lean proteins, and healthier fats. Reducing sugary drinks and refined snacks lowers glucose spikes. Eating consistent meals helps stabilize blood sugar throughout the day. When lifestyle changes are not enough, medication is added. These medicines work in different ways. Some improve insulin sensitivity, some reduce glucose production by the liver, and others help the body release insulin more effectively. Medication is used to protect your organs, not as a punishment or failure. In some cases, insulin is needed when the pancreas can no longer meet the body's needs. Sleep improvement and stress management are also part of care because both directly affect blood sugar control. Type 2 diabetes can often be delayed or slowed, especially when caught early. Warning signs include rising fasting blood sugar, increased waist size, fatigue after meals, and a family history of diabetes. Regular checkups matter, even when you feel well. Practical steps focus on consistency, not perfection. Move your body most days of the week. Build meals around vegetables, protein, and whole foods. Protect your sleep like a medical treatment. Manage stress with realistic tools, not willpower alone. For those already diagnosed, improving blood sugar control reduces complications and improves quality of life. Progress is measured over months, not days. The goal is long-term health, not quick fixes.